Hi there, this is Michael from Ever Better Mind, where I talk about positive and practical strategies to improve your day to day mental health because I believe every small step you take matters. Today, I want to talk about medication, especially those that help alleviate mental health symptoms. For example, antidepressant or antipsychotic. So, if you're experiencing unwelcome side effects from your medication, if you're not responding as expected to your medication, or you're about to commence medication or know someone who might, this is the video for you. Quick warning, medication is obviously a decision only a doctor can make, and you need to make those decisions with your doctor. I'm only providing my own experience around medication, but this is a particularly important message that I have learned that others might find useful as well. So, the problem around medication is that everyone's different. So, when prescribing medication, your doctor chooses the type and dose that usually work for people with your condition or symptoms. However, that isn't necessarily the best choice for you, and the doctor won't know that necessarily at that time. On a personal level, it feels to me a little bit like a process of elimination, which I can see why you have to go down that route at times, and maybe that's the only way sometimes doctors can go through it. But I think the problem with that is that it can take months. You know, if you're really struggling, if you're depressed and you're hoping this drug, it might be an antidepressant or something else, is going to help you. If it takes months just to start working and months to come off it, if there's a way of working out what is more likely to work for you, I say that's going to be a positive thing, because otherwise it could take 3 to 6 months just to work out something isn't working. And in that time, you're really, really suffering. So I think that's the true problem with that kind of process of elimination that may or may not be required. So there is a way to help reduce some of that chance of a drug not working for you based on your specific circumstances. So there is a blood test called a pharmacogenomic test, PGX for short. It's a blood test that examines genetic variations you have in your specific genes. And they usually develop a report that your doctor can use that helps to find genetic variations that might influence how you respond to specific medications. Wow, so that's pretty interesting. So it's a blood test and can help determine whether you will respond well or not to a specific medication. So it's a relatively emerging area, certainly in the mainstream. So in the last 2 years, I've had 3 psychiatrists and 1 GP provide me mental health related drugs. Not one of them has suggested that I do this blood test, which is really interesting. So it is quite emerging, which is why I'm really, really keen that people get to know this, because it's a very relatively low risk way of kind of helping reduce the chances of getting a drug that isn't quite right for you. So why would you need this test? You can help your doctor find the best medication for you by predicting whether a medication will be effective, by helping to identify the right dose to prevent adverse reactions, and to help avoid drugs or doses that might be harmful, which I find particularly important for me as an individual. All right, so let's have a look at what this report looks like. So this is the summary page. So by the way, as well, it kind of provides different categories of drugs. So it's not just kind of mental health related or psychotropic. The report I had anyway had other pain medications and other things as well. So something interesting you might want to look into. But I'm particularly focused on these kind of mental health related ones here on the left. So you can see here there's different categories. Antidepressants, very common. You can see there's a decent list there that they kind of had a looked at. There's also antipsychotics and others as well. So there's kind of 3 categories that they provide. So standard precautions is green light. No worse or different to kind of the usual precautions they provide. Caution is obviously a caution and amber for that drug, and they provide a specific reason why it's considered a caution based on your genes. And then, of course, red, alternatives recommended, is when they're kind of strongly suggesting that the doctor or medical practitioner considers changing the medication being used because it has a very strong negative reaction based on your genes. So quite easy to read that summary. So if I click through, I had a particular problem with vortioxetine. So I was prescribed with vortioxetine, actually, is what I should say. I was only taking it for a week. I got this test and the test results back, and I found that I had vortioxetine as an amber for me. You can see here each amber or red has a more detailed reason why it's amber or red. This is mine, but I started taking it, and in the report saying that I have a significantly increased exposure to this, which may increase the risk of adverse effects. So consider a reduced starting dose and not to exceed a certain amount per day. So you can see it's quite specific, actionable advice, I'd say. And what it allowed me to do is go back to my psychiatrist and say, look, I know we started with this particular drug, but based on this, it feels to me like we should change. And he agreed. Of course, all decisions are made with your medical practitioner, but by providing this information to him, instead of kind of starting on this based on his experience, which I respect, of course, but again, it's experience based on most people with my kind of condition or my symptoms. But this allowed me to pick an antidepressant that was more specific to me, or at least reduce the chance of a negative side effect. So hopefully you can see here it's quite handy, quite useful, and the information, at least for the report I got, was detailed enough to kind of help guide discussions with my doctor. So quite good. Okay, so that's what it looks like. So how do I do it? It's a bit of a tricky one. Again, it's a bit emerging. There might be different countries or areas or doctors where it's not a big deal at all. And it was pretty easy in the end to do it, but you did have to be aware of this thing called a pharmacogenomic, I need a blooper reel, pharmacogenomic test, PGX test. So I searched it, pharmacogenomic tests in Australia. I found a company that does it. From their website, they had like a referral type form. I printed that out. I then went to my general practitioner, my GP, and I said, hey, can you refer me, please? He was like, whoa, what's this? He'd never seen it before. And he kind of signed it off. And I took that to the local blood testing kind of clinic, did the blood test, and 3 or 4 weeks later, I had my report. So relatively easy. Again, simple to do, but if you're not aware and you don't know about it, you never stumble across it, especially if your doctors aren't necessarily encouraging you to do it or even aware themselves. So relatively easy to do. So I'd encourage you, if you're interested in further information, look up pharmacogenomic testing, PGX testing, see what kind of companies come up, and then kind of go to your GP and get a referral. Other areas, countries, etc., might be different. I'm not sure. So as we said at the start, the results of the test are most likely to be useful if you're experiencing unwelcome side effects from your medication, if you're not responding as you hoped or expected to your medication, or you're about to commence medication, or even switch potentially as well. I'm a really big believer of kind of getting as much information about my health as possible. And if that helps my medical team make slightly better decisions and hopefully maybe avoid unwanted side effects of medication, I say that's a really, really positive thing. Of course, as always, you need to make that decision and decisions with your doctors. When I stumbled across this, I couldn't believe that it was such a relatively unknown thing, that all my 4 doctors that I've seen before had never suggested it before. Knowledge is power. Knowledge about your own body is absolute power. So I hope anyone that needs this kind of gets that message and kind of gives it a go and gets more information for them. See you later.